This episode is adapted from a clinician-written piece on Mentalyc and brought to life in audio for therapists who prefer listening on the go.
Yeah, and it was written by Gargi Singh, psychologist whose lens on culture and therapy feels really grounded and real for day-to-day clinical work.
And if you're new to Mentalyc, it's basically a platform that supports therapists with documentation and clinical reflection, so we're not doing everything by hand at 10 p.m. on a Tuesday.
Exactly. So, let's drop right into the room for a second. You know that moment when you're with a client from a different cultural background? They're nodding politely, saying, yeah, that makes sense. But your gut is like, something is off?
Yes, they're technically agreeing, but the energy is flat. Or they keep deferring to what my family would think, and you realize you've been framing everything in terms of individual autonomy, and it's just not landing.
Right. And then later, when you're writing your note, you catch yourself typing, client is insert cultural label, and you pause like, okay, but what does that actually mean for treatment?
Yeah. That's where cultural competence stops being this abstract CEU topic and becomes really immediate, really personal. Because in that moment, we're either deepening the alliance or quietly losing it.
So let's hang out right there. One big, simple insight we want to lean into today is this. Cultural competence in therapy isn't about knowing every culture. It's about treating cultural differences with curious, compassionate respect, and then actually building that into your clinical decisions and your notes.
Yeah, not just I'm open-minded, but how do I show that in session? How do I show that in my documentation? How does it shape my assessment, my treatment plan, my interventions?
Because when we treat culture as a checkbox, race, ethnicity, maybe religion if we remember, we miss the living, breathing reality of how culture shapes symptom expression, help seeking, and even whether therapy feels safe.
Let's ground that. Imagine a 22-year-old client comes in, second-generation immigrant, and they say, in my family, we don't really talk about sadness. It's kind of seen as weakness.
And you can feel the tension in the room. They might be deeply depressed, but the language they can use, the feelings they're allowed to name, are shaped by those cultural expectations.
A culturally competent move there isn't, well, you just need to be more vulnerable. It's, okay, given what emotional expression means in your family, what would feel acceptable? How could we talk about your sadness in a way that still honors your cultural values?
Exactly. Maybe you explore metaphors, somatic language, or talking about stress instead of depression at first. Maybe you use stories or images instead of direct emotional labels.
And then, when you sit down with your notes, instead of writing, client is from X culture, you write something like, client reports that cultural expectations around emotional control in his family make direct discussion of sadness difficult. Together, we explored alternative ways to communicate distress that feel more culturally acceptable.
Yes. Now you've captured something clinically relevant, not a stereotype. You've documented how culture is interacting with symptom expression and engagement in treatment.
And you've also left yourself a trail. Next time you read that note, you're reminded, right, I need to continue anchoring our work in what feels culturally congruent for him, not just what I was trained to see as good emotional work.
I want to name the uncomfortable part too. We all walk into the room with implicit biases. None of us are exempt. Cultural competence isn't, I don't have bias. It's, I'm willing to notice it, own it, and stay curious instead of defensive.
Yeah, and that's where cultural humility comes in. It's that stance of, I am not the expert on your lived experience. I bring clinical skills, you bring deep knowledge of your world. Let's put those together.
And it's active. It's not passive tolerance. It's asking, can you help me understand how your family, your community, your beliefs shape the way you think about mental health and treatment?
I like to think of it as curiosity plus respect plus clinical follow-through. The follow-through is key. If it doesn't change what you're doing, it's just nice talk.
And honestly, this is where a tool like Mentalyc can quietly support that follow-through. Because when your notes, treatment plans, and progress tracking are automated, you actually have a little more cognitive bandwidth to reflect on those cultural nuances instead of just racing to finish your paperwork.
Yeah, we've both had that experience where you get to the end of the day, you remember that something felt off in a cross-cultural interaction, but by the time you're writing notes, the details are fuzzy.
Exactly. With an AI note taker that's designed around your clinical style and that golden thread, you're not just capturing the content of the session, you're also leaving space to add those short, intentional reflections. Clients' understanding of mental health is strongly spiritual. Need to integrate that respectfully into treatment planning.
I want to zoom out for a moment. We know from decades of data that minority clients are more likely to be misdiagnosed, less likely to stay in treatment, and more likely to receive care that just doesn't fit.
Yeah, even when money and insurance are controlled for, provider bias, stereotyping, and unexamined assumptions still show up. That's hard to sit with as a clinician, but it's also a call to action.
Misdiagnosis is a big one. A client's cultural expression of distress can look like oppositional, resistant, or lacking insight if we're only viewing them through our own lens.
Right. Or when a client understands their panic attacks primarily through a spiritual lens, maybe as a test of faith or spiritual warfare, and we label it poor insight, instead of recognizing this as a meaningful explanatory model.
In those moments, cultural competence asks us to pause and ask, is this actually a clinical problem, or is this a cultural difference I don't fully understand yet?
That's hard to sit with as a clinician, but it's also a call to action. Because when clients sense that we're genuinely trying to understand their world, not squeeze them into ours, they tend to open up. They stay longer. They participate more fully. They're more honest about what they really think and feel, not just what they think will be acceptable to us.
And that shows up in outcomes. Culturally attuned therapy isn't just kinder, it's more effective. Treatment plans actually match the person in front of us, not the hypothetical client in a training manual.
Let's give another concrete example. Picture a client who says, "In my culture, you don't air family problems with strangers. Therapy already feels kind of wrong."
If we miss the cultural layer there, we might document ambivalence about treatment and push for more disclosure. But a more nuanced note might be, client expressed cultural concerns about discussing family matters with an outsider. We explored ways to frame therapy as a space to strengthen rather than betray family relationships.
Now the treatment plan can include goals like increase clients' comfort with discussing family stressors in a way that aligns with cultural values of loyalty and respect. That's so different from just improve communication.
And the alliance feels safer because you're not subtly pathologizing their cultural value of family privacy. You're working with it.
This is where documentation really matters. It's not just paperwork, it's a reflection of whether we're seeing the client clearly in their cultural context.
And honestly, it's hard to do that consistently when we're rushed. That's why having your notes, treatment plans, and progress tracking automated through something like Mentalyc can indirectly support cultural competence. You can use the time and mental space you get back to think, what did I learn about this client's world today?
Quick pause here. If this part of the work feels familiar, juggling complex cultural dynamics while also trying to stay on top of documentation, Mentalyc can help. Its AI note taker, AI treatment plan, and progress tracking features support your documentation and clinical judgment while staying fully HIPAA and SOC 2 compliant. You can explore it at Mentalyc.com.
Okay, let's come back to the core practice piece. Cultural competence in the room looks like a few simple but powerful habits. One is asking open, non-leading questions about culture. Things like, how does your family usually handle stress or conflict? Are there cultural or spiritual beliefs that are important for me to understand as we work together?
What would getting better look like to you, given your values and community?
Another is checking your interpretations. If you catch yourself thinking, they're resistant, pause and ask, could this be a cultural norm around authority, privacy, or emotional expression instead?
Yeah. And sometimes the most culturally competent move is just to name the elephant gently. We come from different backgrounds, and I don't want to assume. If I misunderstand something about your culture or values, will you tell me so we can adjust?
That's cultural humility in action. It invites correction, it normalizes that you won't get it perfect, and it gives the client explicit permission to be the expert on their own experience.
And then the last step is bring it into your documentation in a way that's specific and clinically tied in without stereotyping.
So instead of client is Hispanic, we'd write, client expressed concern about involving extended family in treatment decisions, reflecting cultural values of collective decision-making. Treatment planning will incorporate family perspectives when appropriate and with client consent.
Now, that's something another provider or future you can actually use. It points to how culture is shaping engagement, not just what box someone checks.
I also want to highlight that cultural competence isn't static. Our societies are getting more diverse, identities are more layered, and clients bring intersecting cultural pieces into the room. Race, ethnicity, religion, gender, sexuality, immigration history, class, all of it.
Yeah, and no one is going to master that. The goal isn't mastery, it's ongoing reflection. Regularly asking ourselves, how might my cultural lens be shaping my view of this client? What am I not seeing?
That's something you can even build into your workflow. After a complex session, adding a one-line reflection into your note draft. Need to further explore how clients' spiritual framework intersects with anxiety symptoms, or be mindful of my own assumptions about independence versus interdependence here.
When a platform like Mentalyc is handling the basic structure of your notes and treatment plans, you can use those few extra moments to add that kind of reflection. Tiny, but clinically rich. Over time, it becomes part of how you track progress and alliance, not just symptoms.
And that's the bridge between cultural competence and the therapeutic alliance. Because when clients feel seen in their cultural context, when their values, beliefs, and community realities are honored, they're more likely to trust us.
They're more likely to say, actually, in my family, we'd never do that, instead of silently disengaging. They're more likely to tell you, I'm scared what my parents will think about me being here, or my pastor says something different than what we're talking about.
And those are gold moments. That's where real alignment, real collaboration happens. You can adjust your approach, integrate cultural and spiritual supports, and co-create a plan that actually fits their life.
So if we had to distill one practical takeaway for today, it would be this. Pick one client this week whose cultural background is different from yours and add one specific culturally informed line to your next note or treatment plan about how their values or context are shaping treatment.
Just one line, not a dissertation. Something like, client prefers to frame symptoms in spiritual terms. We'll integrate this language into psychoeducation. Or, clients' value of family harmony may limit direct confrontation. We'll use more indirect communication strategies.
If you do that consistently, session by session, client by client, you're not just being aware of culture, you're building cultural competence into the actual structure of your care, your goals, your interventions, your progress tracking.
And if you want some support weaving that into your documentation without burning out, you can lean on tools that are built for this work. Mentalyc's AI Note Taker and AI Treatment Plan can help you keep the golden thread intact while you add those nuanced cultural reflections that really matter.
You still bring the judgment, the ethics, the cultural humility. The tech just gives you a bit more space to practice it with intention.
So as you head into your next week of sessions, maybe hold this question in the back of your mind. How can I be just 5% more curious, 5% more explicit about the cultural worlds my clients are living in,
And how can I let that show up in the way I document and plan our work?
That 5% shift can make the difference between a client quietly planning their exit and a client who feels, maybe for the first time, my whole self is welcome here.
Thanks for being in this conversation with us. And if you'd like some backup as you integrate cultural nuance into your notes and plans, Mentalyc's AI Note Taker is there to help you document clearly while you stay fully present with your clients.
Take good care of yourselves and of the cultural worlds your clients invite you into. We'll talk with you soon.